Welcome back, folks. Welcome back to HIP, Health Insurance Personalized. This is Consumers Doctor on the behalf of Foremost Organization. Today, in my previous episodes, I spoke quite a bit on the impaired health support plans. People who we need to focus on people who are chronically ill. They're truly uninsurable. If the Health Review Authority looks at some of these folks that are truly uninsurable, they have to give a certificate of guaranteed coverage. Once they issue a certificate of guaranteed coverage, it's no longer the insurer's responsibility. It'll be the responsibility of the impaired health support plans. So how do we get funding for these impaired health support plans? They will take care of the people who are really sick and unable to handle the premium. So let's focus on how do we fund these impaired health support plans. Once a Health Review Authority determines they are truly uninsurable, Health Review Authority will give you a certificate of guaranteed coverage. So impaired health support plans under the Health Review Authority will be funded through multiple pronged braided funding of the impaired health support group claims. Impaired health support group plans will be partially funded from the uninsured individuals, who lose part or all of their federal and state income tax filings. Once he loses personal or family exemptions, especially those people who voluntarily chose to be uninsured, those funds will be going to the impaired health support plans. The State Department of Revenue and IRS, Internal Revenue Service, will calculate the increased income tax from the returns showing the loss of exemptions and the tax amount to cover claims and other expenses of the impaired health support coverages. In addition, there are several other sources of revenue for these impaired health support plans. Number one, all premiums paid by the covered lives shall be used for the administration and payment of claims under the impaired health support plans. That's number one. All premiums will be paid by the covered lives. And number two, commissions will be paid by the participating insurers of at least 4% of those individual policies placed with the impaired health support plan or state health exchanges. Insurer or the administrator will be under no contractual obligation to compensate another agent, broker, or third party for the placements made under the Health Review Authority. There is no broker commission, there is no third party payments under the Health Review Authority. And number three, Health Review Authority shall be compensated with a commission of at least 2% of the premiums paid for the group members placed under the impaired health support plans. 2% of their premiums paid for the group members placed under the impaired health support plans. The insurer will be under no contractual obligation to compensate another agent, broker, or third party for the sale of the policy made through Health Review Authority, folks, under the Health Review Authority. And number 4, subsequent to the acceptance of qualifying eligible group member or qualifying eligible individual for health insurance, the policy will be considered as a home office account. Under the home office account, Health Review Authority shall not have any further obligations to the member or the individual for policy maintenance or claims support. And number 5, impaired health support coverage shall be authorized to receive donations, gifts from individuals, private organizations, foundations, and other sources, and shall be authorized to receive state funds, federal funds, which may become available. Any funds received as donations or gifts shall be deemed trust funds to be held and applied solely for the purposes of financially supporting the administrative costs of the health review plans, claims costs of the impaired health support plans. And number 6, impaired health support coverage is authorized to receive direct funds from the third parties into health savings for specific individuals if such an account is properly established by the individual. And number 7, impaired health support coverage tax credit totaling $10 million per year per state for 10 years is authorized for the operations and payment of benefits under the impaired health support plans. Let me repeat this again. Impaired health support coverage tax credit totaling $10 million per year per state for 10 years is authorized for operations and payment of benefits under the impaired health support plans, folks. And number 8, state and federal assemblies shall authorize up to $10 million per year for operation and payment of benefits under the impaired health support groups from the state and federal agencies, folks, from the state and federal agencies. This is how we support the impaired health support plans. The impaired health support plan claims will be supported by commissions, tax deductions, tax deduction losses, not tax deduction, tax deduction losses, those people who don't have insurance. They lose their exemptions, and charity donations, coupled with state and federal subsidies. That's how it supports itself, the impaired health support plans under the Health Review Authority. It's a little bit confusing, folks, but you'll get to it. You'll get it. It basically, people, when they don't buy insurance, there are consequences, folks. If those uninsured voluntarily people don't buy insurance, they lose the exemptions, and they also lose filings for the individual and family. As a result, the revenue collected from this loss of exemptions will be given to health impaired group plans. Not only that, they also get charity donations, They also get federal and state subsidies to support impaired health support plans, folks. This is how we take care of the people who really need the access to care, quality of the care, and the cost of the care. Finally, it will be under the consumer's control along with their health savings accounts. Health Review Authority is an enforcing agency to take care of the people who really need the attention the most, especially with chronic illnesses like 2 to 3% of the folks of the entire population of US have chronic illnesses. They will be covered under the impaired health support plans. Thank you for listening. And if you like, subscribe, share, and hit that notification button. This is Consumers Doctor on the behalf of Foremost Organization. We will see you in the next episode. Thank you, goodbye, and salute.